Let's talk about why losing weight can be dangerous to your health. It's not weight loss per se that's dangerous. It's choosing the wrong strategies, the wrong methods of losing weight that can lead to problems. I've seen it happen so many times. Someone will buy one of those weight loss programs or meal replacement programs, and 2 months into it, they've got pain in the abdomen. They've got gallstones. Very common. It doesn't happen too often, but I've seen people do this. They engage in a weight loss program, and then they have a heart attack. There's a very clear-cut reason for that. Very commonly nowadays, people engage in the wrong dietary program, and a year later, year and a half later, they have other health problems like osteopenia or osteoporosis, thinning of the bones, or they develop colitis or kidney stones. So we don't want to have your weight loss program followed by a significant health problem, and this is very common. The truth of it is that you can lose weight easily, rapidly, safely with none of these health complications. In fact, you can lose weight and actually be far, far healthier, but you've got to choose the right path. So let's talk about the wrong paths to lose weight. The first wrong path is to cut the fat in your diet. This is a very, very bad idea. What happens when you cut fat? Well, two big things. One is you keep your gallbladder inactive. So you need your gallbladder to squeeze out its bile, and bile is required to emulsify and digest fats. Where if there's little fat in your diet because you cut it out, the fats and oils from your meals, the gallbladder is left inactive and not squeezing out its bile. Well, stagnant bile crystallizes and forms gallstones. We now have several studies in which people cut their fat and their gallbladders were imaged using ultrasound every 4 weeks. An astounding number of people develop gallstones starting at 4 weeks and many more by the end of 3 months, 12 weeks. Now, developing gallstones often leads to symptoms of gallstones, and many of those people have to undergo gallbladder surgery. So cutting fat in your diet is a really bad idea and leads to an excess number of people leading to gallbladder surgery. Now, this happens depending on the mix of people in each study, how many are female, how overweight they are, etc. But it happens in as much as 50 to 60% of people. An astounding number of people develop gallstones. Another problem happens when you cut the fat in your diet is if you cut the fat, you have to replace at least some of those calories with something, right? Many people replace it with grains and other carbohydrates. When you up the carbohydrate intake in your diet, a process in the liver called de novo lipogenesis ramps up. That is, the carbohydrates from grains and sugars, the amylopectin A of grains, and of course sugar and fructose, etc., fuel this process of de novo lipogenesis in the liver, meaning that your liver is converting those carbs to triglycerides. So when that happens, your blood triglycerides go up, sometimes way up. It's not uncommon for somebody to start with a triglyceride level of, say, 120, and it goes to 350 or something like that. Besides a rise in blood triglycerides, there's also accumulation of triglycerides in the liver, and that's the start of the process of fatty liver. So cutting fat in your diet is a bad idea. How about cutting calories, which is very popular for losing weight? Well, it does work up front, but as I talked about with the Biggest Loser study, there's an eventual reduction in metabolic rate. It may take some weeks before that happens, so you can enjoy upfront weight loss. It's misery, though, right? Cutting calories is miserable. But then over time, your metabolic rate starts to trend downward, and you're going to find that even if you maintain a low-calorie intake, you still gain weight, which is a very difficult and hopeless situation, isn't it? There are ways to break that cycle, but don't even start doing it. Don't ever cut calories, and avoid having that problem in the first place. Another common problem in weight loss efforts is not taking the steps, not taking the strategies to reverse insulin resistance. So cutting fat, for instance, does not address insulin resistance. You've got to address insulin resistance. That's what I do in my programs. We take foods out that generate insulin resistance, wheat, grains, and sugars, and we address the common nutrient deficiencies that influence your sensitivity to your body's insulin, vitamin D, omega-3 fatty acids, iodine, magnesium, and then efforts to cultivate a healthy microbiome. So you've got to address the factors that influence insulin resistance. If you don't, you're left often with insulin resistance. Some people get worse insulin resistance. It varies based on genetic reasons, but some people cut their fat, for instance, can actually develop worse insulin resistance. And that's part of the reason why the triglycerides can go way up. One of the strategies that I use in my weight loss efforts is to supplement omega-3 fatty acids from fish oil. Because one of the things that happens that is a kind of a defining characteristic of weight loss is when you lose weight, you're mobilizing stored energy from fat cells. And that energy is stored as triglycerides. So part of weight loss is a big flood of triglycerides into the bloodstream. Well, those triglycerides can transiently cause constriction of your arteries, a process called endothelial dysfunction. Well, when the arteries constrict and you have some degree of coronary atherosclerosis in your heart's arteries, that degree of constriction, which can be profound, can actually trigger a heart attack. It doesn't happen too often, thank goodness. But some people who cut their calories or cut their fat and then lose weight rapidly, which does happen in the upfront period, you can actually cause arterial constriction in the coronary arteries and have a heart attack. One of the ways to blunt that is to supplement with omega-3 fatty acids from fish oil, because omega-3 fatty acids accelerate the clearance of those kinds of particles that cause arterial constriction. There's a marked dampening in the rise of triglyceride-rich particles when you lose weight, when you add omega-3 fatty acids to your weight loss effort. So including omega-3 fatty acids to your weight loss program is critical. Another complication of low-carb diet. Low-carb diets are clearly the superior choice for losing weight, for reversing numerous metabolic abnormalities like high blood sugar, insulin resistance, high blood pressure, etc. But there's a flaw in low-carb diets, and that is all prebiotic fibers that nourish bacteria in your bowel flora come in carbohydrate vehicles, okay, like root vegetables or jicama or onions. So there are prebiotic fibers in those kinds of foods, but they come with other carbohydrates. So many people who follow a very strict low-carb diet, they might call it carnivorous or Atkins or ketogenic or paleo. If you cut the carbs but inadvertently fail to get prebiotic fibers, weird things happen. You induce unhealthy changes in your bowel flora. One of the things that occurs is you get a narrowing of species diversity. Healthy people have a wide collection of species diversity, a wide collection of healthy bacteria. Unhealthy people have very narrow species diversity with proliferation of unhealthy species. Well, some of the species that over-proliferate when you cut carbs and thereby prebiotic fibers too severely is proliferation of Akkermansia, the bacterial strain and species Akkermansia. Akkermansia is a good thing to have, but when you deprive yourself of prebiotic fibers, Akkermansia turns to the mucus lining of your GI tract and it eats up the mucus. Well, that's bad. That leads to further degradation in the quality of your microbiome. It also leads to increased intestinal permeability, which is bad, and it causes body-wide inflammation and even autoimmune diseases. And it can cause colitis, inflammation of the colon, and invites long-term diseases like diverticular disease, diverticulitis, and even colon cancer. So failing to get prebiotic fibers in the setting of a low-carb diet is a very big mistake. It also leads to kidney stones and osteopenia and osteoporosis, bone thinning. So that's a big mistake many people make. In my next video, let's talk about how to lose weight safely and not have gallstones, not have risk for heart attack, not have long-term complications like bone thinning, kidney stones, colitis, and inflammation. It's actually easy. And if you feel you're getting something out of my videos, please be sure to subscribe to my YouTube channel. And of course, visit my Wheat Belly blog where I have about 2,000 articles on topics like this and other topics. Also my Undoctored blog. And if you want kind of the most recent summary of my programs, be sure to take a look at my latest book, which is Wheat Belly, the Revised and Expanded Edition.